Good day to each and everyone. So in this video, I will introduce to you the course that we will be having, which is the Nursing 102. So ito pong NSG 102 is our health assessment. So the course title is Health Assessment, the Nursing 102. So ito po yung course syllabus natin, no? So the course description. This course deals with the concepts, principles, and techniques of history taking using various tools, physical assessment or physical examination or your head-to-toe assessment, psychosocial assessment and interpretation of laboratory findings to arrive at a nursing diagnosis on the client across the lifespan in community and hospital settings. The students are expected to differentiate normal from abnormal assessment findings and utilize the concepts, principles, techniques, and appropriate assessment tools in the assessment of individual client with varying age group and development. So ito pong course na to is somewhat focused tayo po sa normal and abnormal findings na pwede nating makita sa ating patient from head to toe. Okay, and we can also identify yung mga differences niya with varying age group and development. So, this course as a credit, meron po siyang credit for the lecture is 3 units. And for the laboratory, which is your NSG 102.2, it's the 2 units laboratory. However, yung sa akin po is lecture lang po. So, the placement is usually tinitake po siya ng ating mga first year during the second semester. So, this is prerequisite po niya and is your NSG 100, which is your anatomy. So, it's very important po na pumasa kayo ng anatomy and physiology because dito po sa ating health assessment, ina-assess natin yung mga iba't ibang major body systems natin. So, kung wala kayong idea with your, anatomy and physiology. So, kung wala kayong idea doon, mahihirapan at mahihirapan kayo, no? So, core requisite po dito is NSG 102.2. Bakit core requisite? Yun po yung skills ninyo. So, sabay po yan siya. Hindi pwedeng mauna yung lecture, tapos mahuli yung skill side. So, the program outcomes of this course, first is to apply knowledge of physical, social, natural, and health sciences and humanities in the practice of nursing. Next, to perform safe, appropriate, and holistic care to individuals, families, population groups, and community utilizing nursing process. So, mainly, ito po yung magiging foundation ninyo para mas mapaganda yung nursing services natin sa ating patient. Kung wala po kasi kayong idea sa health assessment, mahihirapan kayo in rendering services to your patient. Together with your nursing 120, which is your funda, doon nyo naman din learn kung ano yung mga basic procedures na kailangan ninyong malaman during your duties. Okay? So next is to apply guidelines and principles of evidence-based practice in the delivery of care, communicate effectively in speaking, writing, and presenting using culturally appropriate language. Actually, itong communication is more on the therapeutic skills which can be discussed further in your Nursing 120, which is the fundamentals of nursing. Next is to report or document client care accurately and comprehensively, uphold the nursing core values in the practice of profession, and to practice social transformation through excellence in research, instruction and extension, peace education, innovativeness, and collaboration. So at the end of the first year, given simulated situation and selected settings, the learner demonstrate basic nursing skills and rendering safe and appropriate care utilizing the nursing process. Okay po, dito is, ang goal po talaga natin is matuto kayo how to assess your patient head to toe or to conduct your physical health assessment. Okay, so at the end of this course, the learner will be able to integrate relevant concepts, principles, techniques, and appropriate assessment tools in the assessment of individual client with varying age group and development, to assess the client's health status, competence, and formulate a plan of care care to address the health conditions, needs, problems, and issues based on priorities. Another is to implement safe and quality interventions addressing the health needs, problems, and issues of the clients. Next is apply appropriate nursing concepts and actions holistically and comprehensively. Provide evidence based nursing care utilizing concepts, principles, techniques, and appropriate assessment tools in the assessment of individual client with varying age group and development. Ensure a working relationship with the client and or support system based on trust, respect, and shared decision making. Document client's health assessment, ensuring completeness, integrity, safety, and accessibility of information. To observe also the bioethical concepts, principles and core values and nursing standards in the care of client. I think you're currently taking your healthcare ethics. So mostly doon po discussed mostly po yung concept ng bioethics, okay? So demonstrate caring as the core of the nursing and to improve healthy practices to mitigate effects of disaster complications and learn emphasis community cooperation to develop sustainable community practices and peace. So ito po yung mga contents or topics na pwede nating i-discuss for this course. So the purposes of physical assessment, the preparation of the environment of the patient prior to health assessment, our draping and positioning, yan po yan siya, okay? The observation of the client's general appearance and mental status, dito din po dinidiscuss natin yung taking client's history, health history, or cephalocaudal assessment. Actually, itong measurement of vital signs, i-add ko na lang siya para sa information ninyo. But itong may vital signs is mostly nakikita po siya or nadidiscuss po siya sa ating fundamentals of nursing. But dito naman, sa atin, sa lecture natin, I will add na lang din yung ating measurement of vital signs para you have the idea of the normal and abnormal variations of our vital signs. For the effective and therapeutic, kaya po siya naka-red is remove na po yan siya because it is integrated with your fundamentals of nursing. We have also nursing process. I-discuss ko po una yung nursing process kasi you need to have a overview of the nursing process para ma-utilize nyo yun siya for your head-to-toe assessment. And also, the position and draping. So, yun lang po yung mostly na nag-surround niya. Dito po din kasi natin i-discuss kasi sa head-to-toe assessment or your physical health assessment, yung review of systems natin. Kung ano yung normal sa integumentary system, the cardiovascular system, the musculoskeletal system, okay, yung normal po sa ating reproductive system, either male or female. So, yun po yung mga i-discuss natin. Okay, so, the learning environment, classroom. But then again, ang gagamitin po natin is Google Classroom because we are not in a face-to-face setting. Hopefully, pag magkaroon na po kayo ng maraming instructors dyan, so magkakaroon na kayo ng face-to-face. But as of now, dahil kukulang pa tayo ng instructors na pwede kayong ma-meet every now and then, so kami muna na mga instructor dito sa MSU ang nakakapag-discuss sa inyo. But hopefully, we're hoping for the best for this na magkaroon na kayo ng instructor dyan para at least hindi na kayo mahirapan in utilizing the Google Classroom. For the resources, you either use, yung gagamitin ko po dito is yung Kujir na libro na doon po is nandun yung chapter ng health assessment and also the vital signs para naman pwede nyong makuha. So it's either you have a copy, bumili kayo, or just an ebook. For the course requirements, sa lecture, any notebook for taking down notes, syempre. Magbibigay po ako ng learning guide para naman po hindi kayo mahirapan. So, at least meron kayong idea sa mga pinagsasabi ko while watching my video. Okay? For the grading criteria, ito po yung ating grading system para wala po tayong problema, no? So, for attendance or attitude, worth 20% po yan siya. Class participation, okay, such as dito ko po i-under kung meron po tayong presentation or reporting or oral recitation, dito ko po ilalagay yung 10% na yan. But this is again online class participation. Ito mostly po ang pagche-check ko po nito sa class presentation or participation is if you will be tasked to comment at least one insight that you have learned coming from the video that you have watched. Okay? Yun po yung class participation. If nakaka-comment po kayo ng mga insights regarding the topic that I have discussed or sa video na yun mismo, yun po yun. So, gina-utilize ko po yung Google Classroom. However, ang mainly po na pagtuturo ko is more on uh, pre-recorded po kasi po our asynchronous type of learning po yung gagawin natin. Hindi ko po kaya yung synchronous, and at the same time, alam ko rin po na mahirapan kayo for the synchronous because of the signal. So para na lang po lahat tayo makapag-attendance, hindi tayo na-absent, and wala pong repetition ng discussion, and at the same time walang nahuhuli sa klase, ang gagawin ko na lang is pre-recorded. So, it will be uploaded sa aking YouTube channel. Meron po akong YouTube channel. Doon niyo po pwedeng mapanood lahat ng mga lectures natin or lecture videos for health assessment. So, either way, di ba, pag YouTube, pwede kayong maka-download ng YouTube video. So, much better na download niyo yung video ko para at the same time, every now and then, napapanood niyo po yung discussion ko. For the exams, okay, and also pala yung sa class participation, actually mali po to. Itong class participation, tatanggalin ko po, yung sa exams, hindi ko po kasama dun yung quizzes. Sa class participation po, dito yan siya under. Okay, so magkakaroon tayo ng quizzes, 10%, or class participation, 10%. The exam, long exam, major lang po, we have prelim, midterm, and final. So, 40% po yan siya. And then, requirements, 30%. Ano po tong requirements na to? In every coverage ng ating exam, example, prelim, midterm, finals. Kung ano po yung diniscuss natin sa prelim, kung anong systems po yung na-discuss natin na part po ng coverage ng ating prelim, submit ko po kayo ng documentation of ROS or physical assessment tool doon po sa mga parts ng ating body system na diniscuss based on the coverage. So, ipapakita ko lang po sa inyo yung sample po ng ating review of system na tool, yung ginagamit po natin sa physical assessment tool natin. So, yun po yung requirement ko per per coverage. Okay? So, and then a total of 100% po yan siya. So, ito po yung ating references na ginagamit. Cogier, Lippincott, Taylor, ganyan po. Pero ito po is mostly, ang na-utilize ko dito is your Cogier po. Kasi, ando doon po yung chapter ng health assessment and also the chapter of vital signs. I think yun po lamang yung ating discussion for the course syllabus. Bakit ko po ito diniscuss is para po magkaroon kayo ng idea kung ano po yung itatakbo ng ating course na ito at saan po siya nakafocus. So, a partner po ng ating 102 is 102.2. So, I hope marami kayong ma-learn dito sa course na ito kasi this will be applied for your skills. 'Di ba? Nakakaya naman sa skill sides ninyo kung nahihirapan kayo. So remember, kung wala kayong alam for the lecture side, mahihirapan kayo in implementing what you have learned, okay, sa inyong skills. Kasi sa skills po is more on the activity, no? The procedures, paano i-assess. Pero yung mga normal and abnormal findings, para ma-understand kung ano yung normal at saka yung mga abnormal, dito po yan sa lecture side. So thank you for watching my video. So I hope you will have a nice day ahead. Thank you!